think it was this one. Yep, here we go. The one that freaks everyone out. If you're tuning in and you're like, what the heck is that? Then have a look at last week's. Well, the last 3 weeks we went over this and talked about what all of this is. Let me just move me over there. So we've got just a little bit of a recap of all the nerves, and then we'll move on to the blood supply for their neck and into the shoulder. So we're going around that area. So these are your nerve roots. C5 down to T1. Let me just move that there. There we go. And we were talking about all the different nerves that come off all the different bits. So we've got roots, then trunks, then divisions, then cords, and then they end up then being peripheral nerves, the distal nerves. So off of the roots, we've got a couple of nerves, the dorsal scapular nerve and the long thoracic. Just going to do a quick recap of this. So if you don't know what they are or what they do, then have a look at their previous episodes. As they split into trunks, it's only this upper trunk that's got a couple of nerves coming off of it, to subclavius and the suprascapular nerve as well, that one just there. And then we've got divisions, so we've got a strike and a spare, and so C8, T1, they come together to form the lower trunk, and then there's a division that comes off, and this arrow here goes posteriorly. So if you have a look, it ends up on this posterior cord just here, so that one goes to the back. And then C5, C6, they join together to form the upper trunk, and then this one goes back as well. So contributions from there and C7 all make up this posterior cord. And then the posterior cord has got these nerves coming off of it, specifically going to various different places of the chest wall. So we've got upper and lower subscapular nerves. So there's 2 nerve supplies for subscapularis, got upper part and lower part, and then the thoracodorsal going to the lats. So that's coming off of that posterior cord. And then we've also got from C7, so this one here where there's the strike, so that branch there, that division, that's going anteriorly to join this lateral cord. Okay, so basically they split, and some go backwards, some go forwards, some go around the outside, some go around the inside, and basically the names should hopefully give it away as to where they go. On this medial cord, we've got these 3 nerves that come off here, and 2 of them are purely sensory. So they're cutaneous nerves. And if you've done any kind of study around dermoneuromodulation, then you might have heard of these nerves. And then the medial pectoral, going towards pectoralis major and minor. And then this one here as well, the lateral pectoral. This one is the other part of the supply going towards the pectoral muscles, but that's on the lateral cord. So you've got supply coming from the lateral cord and from the medial cord going towards the pectoralis muscles. And then after all of that, they end up, oh, where's it gone? Why is that not working? Hold on, bear with me a sec. Let's look at that. There we go. Then we end up with this. So this is where we ended up. So all of those nerves so far have been taken away. Okay, so strip those out so it's a bit easier to understand. And then from this lateral cord, you've then got the musculocutaneous nerve and half of the median nerve. And then from the medial cord, you've got the ulnar nerve and then the other half of the median nerve. So you can see how it forms like this sideways M shape, and the median is in the middle. Okay, so that hence the name. And what we'll do is we'll cover these nerves in a bit more detail when we get into the shoulder section, which is next. And we'll also cover these nerves in a bit more detail as well as we go down into the forearm as well. So the axillary and the radial nerve come off of the posterior cord. All right, so that's that. Those branches just there. And that was the brachial plexus in 2 minutes. If you want a bit more in-depth with that, then that was the last 3 weeks worth. Okay. Morning, David. Morning, Lizzie. No worries. Yeah, and morning, Steph. Good to see you in as well. Right. Let's have a look at today's session. Here we are. So, blood supply. Why is that not showing? Just get rid of that. So blood supply for the cervical region as well. Bear with me a sec. Let me just get this working. We want that. There we go. Oh, see my green screen. Let's get that. There we go. We don't want that. We want that. That's better. Okay, so we've got blood supply for the cervical region. So what we're going to do, we're going to start with the thorax, and we covered this when we looked at the thoracic spine, and we covered where the the blood supply comes up and then starts to come up into the neck and into the shoulders. So we're going to have a look at that, because this is really useful when to get your head around the vascular thoracic outlet problems that people might have, and the reason why the tests aren't that great for it. But when somebody has odd sensations down their arms, then we may be able to work out potentially what's going on. So depending on what kind of symptoms that they're getting. So usually with a nerve issue, and we'll cover this a bit more when we get down into the shoulder and the arm. We've looked at dermatomes already, and if you have a nerve root problem, there will be potentially a dermatomal change. So and there are specific regions of the hand, in particular, that are affected with different nerve roots. So C6 is kind of around the thumb and pointer finger. C7 is the middle finger. C8, T1 is this kind of area here with the little finger. And often people will complain of that. So they'll go, oh yeah, my little finger's got feeling a bit weird. Okay, but the other fingers are fine. Or my thumb feels a bit odd, but the other fingers are fine. If there is a blood supply issue, then it's usually a whole hand issue, or a whole limb, because the blood supply is to the whole limb. So if there's a problem higher up, then it will affect the whole hand. That can also be something to do with the neck, the spinal cord, and the nerves as well. But it can help us try and work out if it's potentially one or the other. But we're never going to know in clinic. We need to get them off and get them tested. So there was an example I had in clinic the other week with one of my patients where she had whole hand numbness, and but it was on both sides, and which is obviously unusual. And it came on all of a sudden. It wasn't something that was kind of like a slow build up. So we immediately sent her off for an MRI, and she had neck surgery about 2 weeks ago. Okay, so some things are just like, I think you need to go and get that checked out. Okay, so and I'll give an example for me. So my thumb went completely numb for about 8 weeks, something like that. When I lifted a really, really heavy deadlift, felt something pull in my neck and around my collarbone, and then immediately shooting pain into my thumb went dead. Okay, so and eventually it came back, so that was fine. But you can get those kind of things in obviously weightlifting, where something's pretty heavy and your arm's dangling off of the weight. But it can also happen with impacts, like in things like rugby. You can get what's called a stinger. So where you go in for a tackle, and either your arm gets wrenched or your neck gets wrenched really, really quickly, and it pulls the nerve really quickly, and that can irritate the nerve, and then you lose sensation in certain areas. Okay, so and that so again, like listening to the story, listening to the subjective history is probably more beneficial than the objective findings that you get from clinical tests. But obviously the combination of the two is the best that you can get for working in clinic. So let's have a look at this blood supply. We are starting with down here, so the brachiocephalic trunk. So we've got the this is coming off the heart. Again, we covered the heart a few months ago now, and the aorta is your main blood vessel off of the heart. And there's an arch in the aorta, so it comes up, creates this arch, and then comes down. And the ascending part of the aorta, so the bit that goes up, that is pumping freshly oxygenated blood up towards the arms and the head and neck region. Okay, and then we've got the arch of the aorta as it curves over, and then it goes down into the descending aorta, which we will have covered when we looked at the thoracics and the lumbar spine and down into the hips. Okay, so we've seen the other end of this descending aorta as it ends up as the iliac arteries around the hip region and in the pelvis. So what we've got here up into this area here, so this is the right side of the body. So if you're looking at someone, then it's their right hand side rather than the right hand side in the picture. So you got the brachiocephalic artery, which is this one here. So you'll notice on the right we've only got one tube. On the left there's two tubes. So on the right side it splits a little bit higher up. Okay, so we're going to have a look at that. Where it splits just as it's kind of emerging from the aperture, which is the opening on the top of the rib cage, it then splits into the subclavian artery. So subclavian means underneath the clavicle, so that will go underneath the clavicle. And then this one here, which will be your carotid, and that will go up into the or towards the head and the neck. This one here is separated. Okay, so there's two. So you got this one here, which will go up to the carotid, and then this one here, which is your left subclavian. So that will go towards the arm. Yeah, so it's just a little bit of a different design, right to left, just because of the shape of some of the organs around the in the thoracic cavity. So this right side subclavian artery, this will go to the arm, and we're going to have a little bit of a look at that. But we're mainly interested in these ones up here for now, and then we'll follow those subclavian arteries when we get to the shoulder. So let's have a look at that. So this is the blood supply for the shoulder. All right, let's just pause that there. Okay, so just give you a bit of an orientation. So then there's your brachiocephalic, yeah, and on the picture it looks as if it's you know, just a really small tube from that from the PowerPoint presentation before, but you can see it's quite a big vessel there. There's your first rib, so this will be a scalene muscle just here, but hopefully you can see the split in the vessel. So that bit there, that's your subclavian, so that's going towards your arm, and then that bit there, that's going up towards the neck. Okay, and you've got some other little branches that come off of this subclavian as well, and we'll talk about that in a sec. Let me just sort this camera out on here as well. Sorry, bear with me a second. For some reason it's deleted all of my cameras. Alright, got that. Bear with me a sec. That one and that one. There we go. Okay, cool. So yeah, so this one's going up to your head and neck. This one's coming towards your arm. There's the scalene just there. So this is your windpipe. So your trachea as it's coming down there. So there's your anterior scalene, second rib just down there. So we've had some of the ribs removed. So there's your trachea. So this is the image that we've just seen. So that's your brachiocephalic. That's the arch of the aorta just there. Excuse me. And this is the left side where it's got two arteries that are split. Okay, so if we just go back to that PowerPoint, that's basically that. Okay, so there's your ascending aorta, arch of the aorta, descending, left subclavian, left going up to carotid, brachiocephalic, and then it splits. Okay, so let's just have a look back at that video again. So we'll have a look. It's important to see this bit here, so we can see where the neck part comes. So that's the image that we've just seen, is just down here. So there's the arch of the aorta, brachiocephalic trunk, and then your carotids and subclavian just there. So we've got quite a, well, I've called them left brachial artery because they end up being the brachial artery. So there's your brachiocephalic trunk, arch of the aorta just there. So your heart's down there. And there's your left brachial artery, which at that point is the subclavian. Okay, right, let me just pause that there. So give you another view. So this is the collarbone. There's your subclavian artery. Okay, that's your scalene just there. All right, so we've seen kind of like the other ends. This is the right side. Top of your lung is just there. If I just rewind that, okay. So that's important as well, that top of the lung bit. Let me just pause that. Okay, so top of the lung is literally just there. And this is the thing. You kind of imagine your lungs to be in your rib cage, I think, but they come right up to the top here. And that's sometimes a bit surprising for people. They didn't realise that they were that close to kind of like scalenes and all that kind of thing. So literally, there's your scalene, there's the end of it, and then there's the top of your lung. Now you can get something called a Pancoast tumour, and that is or an apical tumour, and that's a tumour at the top of the lung. Okay, so if you imagine if there was a tumour here, as it grows and it pushes up, because it's not covered by the rib cage, it's all the vessels and nerves above it. So a common thing that you can get, it looks a bit like thoracic outlet syndrome. Okay, because if it's pushing up and squashing the blood supply, it's going to interrupt that blood supply. Or if you think about the brachial plexus that we've just seen, the supply that the nerve supply that's the lower part is from C8T1, which is the ulnar nerve. So you often get ulnar neuropathy as well. So symptoms into your little finger, ring finger, and that's because of where that tumour is. So if it's growing and then pushing up, it's going to get those lower nerves and that blood vessel. So again, this is why diagnosis, and I think I had a rant about this last week, diagnosis via Facebook is not very good, because you need to ask some other questions about how long it's been going on for. Are you getting any other symptoms? Is it affecting you? Have you got any issues with your breathing? Are you a smoker? Have you had any history of cancer? There's so many questions that you need to ask that, oh, my patient's got tingling into their little finger, what could it be? You know, it's really, really difficult. And so you need to layer on all of that information. So top of the lung, blood vessel coming through, there's your anterior scalene. So that will eventually become your brachial artery. So there it goes there, underneath the clavicle, so subclavian, and then axillary artery once it kind of reaches the end of the ribs, underneath your pec minor. You've got artery going towards the chest wall, and then it comes all the way down the arm and then turns into the brachial artery that just there. And if you remember, it was enveloped within the nerves. Okay? Don't need to worry about these just now. I'm just going to give you a bit of an overview. We'll cover all this when we get to the shoulder. Okay, so that's where it's starting, and so that's this bit. Just well, we've had a look at this right side, so we'll have a look at that subclavian artery, and we want to have a follow up of the carotid. We want to just take that a little bit higher. So let's just to that one. Bear with me a sec. Hopefully this will be it. Okay, so going up into the neck a little bit more. So blood supply for these cervicals. So the sternocleidomastoid has been removed. And then we've had the jugular vein removed as well. So that this is where we were. Bear with me a second. There we go. Is that working? No. I'm trying to pause it. I've got so many videos layered on top of each other. Nothing's pausing. Okay, right. I finally got it to pause. Oh no. Right. Let's go to that. Bear with me a second. Right, okay, it's that one. That's not pausing. Okay, yeah, we got it. Right, let's go back to the beginning. Start that again. Right, so sternocleidomastoid removed. And in fact, let's just go back because there's an important part there. Okay, can you see this here? Yeah. And then the outline here, that dotted line there, that's sternocleidomastoid. Can you see that lump there? Yeah. So there's a big old lump of blood vessel just there. And if you're my kind of age, then you'd remember the Vulcan death grip from Star Trek, and Spock would grab people's necks and then they'd faint. Yeah. The reason why they did that is because humans are susceptible here. This bit here, this is the carotid sinus, and it is full of receptors that detect your blood pressure. They're called baroreceptors. So if you again, this is showing me age a bit. I remember my granddad had a barometer, and I was always fascinated by it because it measured pressure and air pressure and stuff like that, and it had all the temperature gauges and stuff on it. So barometer measures pressure, as does your baroreceptors in your body, and in particular this area here. So if you push on this area here, then you can knock someone out. Okay. It is underneath the sternocleidomastoid. So if someone's lying down, then it's not so much of a problem. But if you've got someone that is seated or stood, and then you do any kind of like aggressive manual therapy to the sternocleidomastoid up around here, you can impact that carotid sinus and you can knock them out. Okay, so just be, if you weren't told that on your manual therapy training, then just be aware of that. So that sternocleidomastoid has been removed, and we can see behind it, we can see the vessels. So the infrahyoids, we talked about those a little while ago, they've been removed. There's a vein called the jugular vein, that's been taken away as well. Right, so this is kind of where we were on the last image. So there's your clavicle, you've got the pec coming into that, and we can see these vessels that were coming up. So remember, there was the brachiocephalic trunk, there was another tube coming off of that, which was the carotid, or the common carotid, and then another tube, which was your subclavian. So there's your scalene, just there. So you can see the vessel coming behind that, that's going to be your subclavian, and then this one coming up here. So let's have a look at where those go. So first rib is under there, there's your anterior scalene. So these are all the bits that we've just seen. You can see how tightly packed everything is in this area. So there's your common carotid. Just take that back a little bit because that went really quick. There we go. Okay, so there's your common carotid, just there. And that will split, where we've just seen that carotid sinus, it will split into your internal and external carotid. Now, this bit of blood supply is the bit that goes towards the brain, but also towards the face, so into the skull. There's also another bit of blood supply that comes off of this area that forms the vertebral arteries that is protected by the vertebra. And remember, we had those transverse foramen, those holes in the side of the vertebra where the blood supply went up. Okay, that's not this bit. There's another bit. Okay, so there's quite a bit of blood supply coming up to this area, and it's I mean, this bit is not so well protected, but the vertebral artery definitely is. It's encased in bone. Okay, so we'll have a look at that in a second as well. So there's your common carotid, and there's your subclavian. So just coming through there. So that's the bit that we've just seen. So those two will join together down here somewhere to form that brachiocephalic trunk. Okay, and that's where they've split. So subclavian is under the clavicle. So they're both coming up through here, through this aperture. There we go. Just pause that there. So you've got arch of the aorta, covered a little bit by that arrow there. Subclavian going towards the left. Common carotid coming up towards the left. And then the brachiocephalic just there. And then that then splits into the right subclavian and left common carotid. Okay, so that's what we're seeing here. That bit just there. Okay, that's the bit that we're looking at. So that bit just there is where we are right now. So the the right side's different to the left, as we said. So this is joined up and then it splits. There's your subclavian. And then we've got these little blood vessels coming off of that subclavian. Anterior scalene muscle just here. So you can see how close that is to the scalenes. And that this is one of the reasons why the scalenes may be involved in some kind of thoracic outlet. Yeah, so if there's some kind of increase in tension through the scalenes, then that can potentially impact this subclavian. And this is what I mean. I mean, it could be the clavicle as well. So coming back and depressing. A classic is someone wearing a really heavy rucksack. So they're wearing a heavy rucksack, which is like pulling their shoulder blade, their collarbones back, and that can occlude or block this artery, and it will make your hands go numb. Yeah, and and again, knowing where the anatomy goes can help you work out what's going on with those kind of cases. Right, here we go. So there's your subclavian underneath your anterior scalene. That's going into the thorax. We've got something going towards your thyroid. And then this one here, this is the important one. Okay, cool. So that's your subclavian artery there. There's your scalene. And that little offshoot of the subclavian, that is going to end up going up the side of your neck. Okay, so that's your vertebral artery. It's not the carotid. Yeah, they're two separate things. I don't know what you had in your mind, but they're two separate things. So we've got subclavian going towards the arm. This one going up towards the head, face, and neck. This one is going directly to the base of the skull. Okay, or it will do eventually. So just play that one through. There's your common carotid, and then there's your carotid sinus. So it splits into two, and remember the sternocleidomastoid is over there. So we're coming up to the mandible mastoid process up around here. So that's your external and internal carotid. So they split. So around this area here. Okay, so just underneath your jaw. And that's the split just there. Okay, so we're interested in this bit. There's your carotid sinus, external and internal carotid, just there. So these vessels are some of them are going to go up to the brain, up to the skull. Some of them are going to supply the face, and the ones we're interested in for MSK work is the vertebral arteries. Yeah, so there's your carotid sinus. So that's the bit that's full of baroreceptors. So it's measuring the pressure obviously that's an important area for the body to monitor blood pressure, because that is the blood supply, or one of the blood supplies, to your brain. So it needs to make sure that the pressure is good. If it's not good, then it will make you hit the deck so that it's easier to pump blood around. And that's one of the reasons why if you mess around in there, then you can make people, well, looks like a faint, okay, because you've disrupted the baroreceptors, so it thinks that the brain's not getting a good blood supply, so it will make you hit the deck so that it's easier to pump blood to the brain. Okay, so that's that area just there. Okay, so kind of high up on that sternocleidomastoid. Okay, cool. Right, just had some. Yeah, so Lizzie asked about what are the ones around the front to the scalene. So yeah, those are the ones that are going towards either the thyroid or down into the thorax, so the internal thoracic. And then some cyclists get numb hands whilst riding, stops as soon as they stop. That's usually an ulnar nerve issue, because they put pressure on where the nerve is in the hand. So you've got the hook of the hamate and Guyon's canal, and it's there that puts pressure on it. And then as soon as you take your hand off, give it a shake, it re-establishes the sensation again. Okay, but that's quite a common one. Usually cycling gloves have got a bump around that area just to protect that nerve. Okay, so that's usually what that one is. If it was the whole hand, potentially blood supply. If it could be nerve still, but if it's those fingers and it's a cyclist, it's usually the compression point by the wrist. Okay, so that's usually that one. Cool. Okay. Right. So these are your carotids. This is what we've just seen. So the carotid artery is the common carotid, and then it splits into external and internal. And the internal is coming up here, and then it comes up here and it meets up with some other blood vessels just at the base of the brain. This one here, so your external, this is going towards the cheek, towards the jaw, so supplying all this region of your face with blood. Okay, so that's where your carotid are. So we've just seen those. And then the ones we're interested in as well, more so really, are the vertebral arteries. So we've got different sections of the vertebral arteries depending on where they are. So we've got V1, V2, V3. So what we've just seen in the video was the brachiocephalic trunk. So that's that bit there. Common carotid. So that's that bit. And then your subclavian, which ends up becoming your brachial artery. And then the subclavian had this little branch off it, which was your vertebral artery. And that then travels up on the transverse foramen, so either side of the either side of the spine, so the actual vertebral vertebra, and there's a little hole all the way up, and then around this area here, can you see? So this V3 area here, this is where it kinks a little bit. So C1 obviously is where most of your rotation comes from. So if you had blood vessels that just went straight up, so if you imagine two hoses going straight up and they were just in a straight line, and then you had something at the top that pivoted, which those hoses went through, it would pull those vessels, okay, and it would create, over time, as you rotate, it would create some irritation, some wear to those structures. So what the body has done in its wisdom is it's created a bit of slack. Okay, so as we come up here, the vertebral artery goes out and then comes in. So it's like a question mark shape. Okay, and the reason for that is so that we can turn our head, because if they were straight, it would kind of get stuck, but because there's an excess bit of artery, then we're able to rotate without disrupting that blood supply, because obviously the blood supply in this region is really important, because it comes up here into this bit here, which is called the circle of Willis, and this bit here is the bit that supplies your brainstem. Okay, and there's offshoots all around the brain. So we always get worried about, especially this area here, because it's curved. Wherever there are curves in blood vessels, there is an opportunity for plaque to deposit itself, because of the flow of the blood getting through. And if you've not got very healthy blood supply, you can get deposits of plaque on bends. Okay, so the same happens where the descending aorta comes down and then splits into your iliac arteries around by your belly button. Because of that split, we get a bit of turbulence, and then some plaque can gather there, and then that can create a blockage, which can create something called an abdominal aortic aneurysm. Okay, around this area here, if this bit hardens, so we get plaque which disrupts the wall of the artery, and then you have a joint manipulation done, it can crack that vertebra. And although it's very, very rare, there have been instances where people have been killed because of a bleed from a vertebral artery dissection at this point, okay, after a manipulation. So it's one of the reasons why we're really, really careful about doing any kind of manipulative therapy around this area here. So not only do you have your spinal cord coming through that area, you've also got the blood supply to your brain as well. Okay, so it's a really compact area. Right, let's have a look at this one. So there's your vertebral artery from before. Okay, so that's the carotid, and at the moment it's the common carotid. There's your subclavian. There's your anterior scalene. So that little bit coming off there is coming off of this subclavian artery. There's your collarbone just there. So it's the front of a right shoulder we're looking at. And you can see how buried it is. Look how deep this goes. So you've got all this musculature around this area as well. So common carotid splits into external and internal. And then here comes your vertebral artery. So these are your transverse processes of the cervical spine, and there's the blood vessel traveling up through these holes on the side. So those transverse foramen, there it goes, snaking its way up. And then when it gets to the top, we've got that extra bit of blood vessel so that you can turn your head, and then it will go onto the inside of your skull. There it is, coming up there, and that's what obviously where your brain will sit, around that area there. And then it joins up to become the basilar artery at that point just there. I think that's the end of that video. Yeah, let me just play that again because that's brilliant. Okay, so vertebral artery just coming up here. You've got all of this soft tissue in the way, which is really good, help to protect it, and further protection from your vertebra, which again, I don't know if you kind of imagined it, but they're quite deep structures. Yeah, so there it goes. There's the sides of that vertebra just there, so you can see the vessel as it's kind of snaking its way through, and it's going through these holes on the side, so these transverse foramen, so side holes, that basically means. And then as it comes up to the top, so the C1 area here, there's a bit of extra blood vessel so that it's not just straight up, so it's got room to move. And then it comes inside the skull, and then both sides, so right and left, come together to form the basilar artery at the top, just there. Okay, and you can see these little blood vessels coming through here, so that they're from the carotids from before. So they're all of these then joined together. And if I just show you this one, there we go. So that's the basilar, which what what we've just seen. The other little vessels that we saw were the ends of the internal carotid. So do you remember that one that went up the side, kind of like round the jaw, and I said that disappeared and went up to supply your brain? That's it there. Okay, emerging there. And then there are these little communicating vessels that create a ring at the base of your brain. Okay, so you've got blood supply to your brain from the carotids and from the vertebral arteries, and they come via different networks all the way to the base of your skull, and then create this circle, which is called the circle of Willis. Whoever Willis was, I don't know, but he obviously discovered it and named it after himself. But yeah, that is something that is when you see it for real, it's just like, it's an absolute marvel. It's unbelievable. So let's have a look at that to finish off. Excuse me. Here we go. Okay, so look how close everything is. There's the spinal cord. Vertebral arteries, which is what we've just seen coming up as from the left and the right side, come together to form the basilar artery. Your internal carotid arteries were here. We just saw those on the last video, and again you've got right and left of those as well. So vertebral arteries, basilar artery, and then there's the circle of Willis. Okay, so your carotid arteries will come up to meet it. There's the internal carotid left and right, and there it is there. There it is, poking through. And then you've got communicating branches with each other, and they all link up together to form this circle of blood supply at the base of the brain. And then you've got all these different little arteries that will go off and go to all various different parts of the brain. Yeah, you've got these like little fissures in the brain where things travel through. This is the optic chiasm. Yeah, there you go. Little communicating artery there as well between those two. Amazing, isn't it? Such an amazing design. Yeah, so again, we've got another supply coming around this fissure in the brain as well. There's a bit of atherosclerosis in this one, so a bit of plaque. You might have heard of those kind of things, having atherosclerosis in vessels. And if the blood supply can't get to certain regions, then it will obviously affect brain function in this case. So there's your basilar. These are your vertebral arteries coming down, and they virtually go by your spinal cord. Posterior cerebral arteries round the back. And that's it. Okay, so we followed your blood supply. I am muted. Sorry about that. I think you missed the last bit of me describing where everything went. So we had your brachiocephalic coming up into the carotid, and then subclavian, and then the carotid then split went towards your face and then up to the base of your skull, and then your vertebral artery coming off of that subclavian in between all of the transverse foramen and then meeting up with the internal carotid right in the base of the skull. And if you've got a problem with one side, then the other side can kick in, because it's a circular network. Yeah, so problem one side, the other side can pick up the slack. Problem the other side can. Where there's only one vessel, if there's an issue with that one, then we've got a problem. But hopefully that all kind of makes sense. Fingers crossed. So that is your whole cervical region. So we've done the bones, we've done the ligaments, we've done all the muscles, we've done the nerves, had a look at the brachial plexus, and then finished off with the blood supply. So our next job is to move a little bit laterally. Okay, so we're going towards the shoulder. So going to do bones and joints of the shoulder, ligaments, then the muscles, and so on and so on. So we'll do the same again, and then by the time we get to the nerves, we'll link up the peripheral nerves with what we did with the brachial plexus, so you can see the pathway as it carries on. Okay, cool. I will see you next Monday, 10 o'clock.